The functions of the respiratory system are to bring oxygen into the body and to eliminate carbon dioxide produced as they use oxygen. There are several types of diseases associated with the respiratory system. The three common diseases are COPD, chronic obstructive pulmonary disease, bronchitis, and emphysema. COPD, chronic obstructive pulmonary disease, is a chronic disease. This means that a person may live for years with it but never be cured. People with COPD have trouble breathing, especially in getting air out of the lungs. There are two chronic lung diseases that are grouped under COPD: chronic bronchitis and emphysema. COPD is also known as chronic lung disease. This leads to a limitation of the flow of the air from the lungs, causing shortness of breath. COPD usually gets progressively worse over time. In England, approximately 1 person in 59 receiving a diagnosis of COPD at some point in their lives. COPD is caused by noxious particles of gas, most commonly from tobacco smoking, which triggers an abnormal inflammatory response in the lung. Bronchitis is an irritation and inflammation of the lining of the bronchi. Chronic bronchitis is a form of bronchitis that is usually caused by cigarette smoking. Symptoms include persistent coughing that brings up sputum or phlegm and mucus. Breathlessness and wheezing may be present. Treatment includes stopping smoking and possibly medications. There are two types of bronchitis: acute and chronic. Acute bronchitis is characterized by the development of a cough with or without the production of sputum, mucus that is coughed up or expirated from the respiratory tract. Acute bronchitis occurs during the course of an acute viral illness, such as the common cold or influenza. Viruses cause about 90% of cases of an acute bronchitis, whereas bacteria causes for less than 10%. Chronic bronchitis is characterized by the presence of a productive cough that lasts for 3 months or more per year for at least 2 years. Chronic bronchitis develops due to recurrent injury to the airways caused by inhaled irritants. Emphysema is a chronic disease of the lungs that usually results from chronic bronchitis and cigarette smoking. People with emphysema have trouble breathing. Other symptoms are coughing, breathlessness, and a fast heartbeat. There is no cure for emphysema. Treatment includes managing symptoms and pain. Oxygen therapy may be ordered as well as medications. Quitting smoking is very important. Emphysema is a long-term progressive disease of the lungs that primarily causes shortness of breath. In people with emphysema, the tissues necessary to support the physical shape and functions of the lungs are destroyed. All in all, COPD, bronchitis, and emphysema are all diseases of the respiratory system. All three of them can lead to an acute lung infection, such as pneumonia.